Colorado ranks 7th in the nation for deaths by suicide. And because this month is Suicide Awareness and Prevention Month, it's really a good time to share that there are resources available. Joining our conversation this morning is Fisher and Marchell Taylor, with WellPower, a community mental health center in Denver. Thank you both so much for coming in.
Thanks for having us.
It's an important message. It seems like more and more people are struggling with mental health issues. Is that what you're seeing at WellPower?
Yes, we do. We see people with a great deal of life stressors, mental health issues, interpersonal relationship issues, and fortunately people are seeking treatment. That's one of the silver linings of the pandemic, is more and more people have an awareness.
That is good. What do you want people to know about suicide?
One of the biggest takeaways that we can kind of get out today is that everybody plays a role in suicide prevention. So if your neighbor, if your family member, your coworker, anybody in your circle of contacts is going through some kind of stress, talk to them about it. Don't avoid it. Don't feel like this would be too rude or this would be, but instead gently approach them and be respectful and compassionate and have a conversation. And then if you find that they are in distress, help get them to crisis services or some kind of outpatient treatment so that they can get the help they need. And
there are a lot of services that are available right here in the state, a lot of resources, which is great. So Marchell, your story is pretty incredible. It's come really full circle in your life, but you had a point in time where you were really struggling. You had suicidal thoughts. Talk about that and where you are today.
You know, Steve always say, he taught me well, he says, emotional pain minus acceptance equals suffering. So when you live in the disorder, it becomes normal to live in it. So the normal life is the disorder life. Suffering for so long like that, and then finally going back to prison 6 years ago, doctors came in, gave me treatment, and transformed me into an advocate. Living in those dark emotional periods, you can only suffer for so long before your body, brain, and mind just shuts down. And that's kind of what happened. It just shuts down, and Steve, Nina Minagawa, our Professor Kim Gorgans, really focused on decreasing that disorder inside of me. I always say they uprooted the psychological cancer that had lived inside of me so that now I can live in the power of wellness. And that's what it is. It's about getting treatment. We're afraid, especially the minority communities. They're afraid to get treatment. They don't understand that they're sick. They live in it for so long. So now getting the treatment and being transformed, I just always say, from prison to WellPower.
So you recognize what was going on, right? You got treatment, and now you help others.
Yes, I work as on the zero suicide team at WellPower. Like I say, from prison to power, you know. And I'm a caring contact person where I call individuals that are on our suicide prevention pathway and let them know that we care. Let them know that we're there for them every step of the way, and if I can resource them out. It's a new program we started, thanks to my supervisor, Steve, our psychological shepherd, I always call him. And we just want people to know that there is power in wellness. There is power in treatment. There is power when you come over to this side.
Well, I think that you sharing your story is so powerful, because I think a lot of the times people feel connected to someone who has walked the path that they're in currently. And so that's why your voice is so important.
It's almost like talking to myself on the other side.
You know, you've been there, right? Yeah. Well, this is great that you guys came on and talked about this, because I really think that mental health is something that we need to talk about more, something that, we're dealing with a lot lately. So this is really great that you came on. Thank you so much.
TBIs, Wonder Woman of Brain Science, Professor Kim Gorgans, how it applies to suicide.
Okay. And so as we were talking about, there are several resources that are available right now, including WellPower. If you need to talk to someone immediately, help is always one call or text away. You can now text 988, which is also the new mental health crisis hotline as well.